Hello, everybody, and welcome back to a new episode of Geigenomics. I'm happy to announce that it's been some time, quite the hiatus, but Geigenomics is back weekly, probably on Tuesdays, and I'm excited about that. Just excited to talk about economics and the philosophy of liberty and everything in between. So, I want to start this podcast episode discussing Fauci. Now, in the previous episode, I said I don't trust him and I don't like him, and I still remain by that. But he recently joined Trevor Noah on The Daily Show, and they did an interview. And there was one thing in particularly that stood out about this interview that really caught my attention. And in the interview, they're obviously discussing COVID-19, everything that pertains to that. And then they brought up the economy. And so, obviously, this sparked my interest. And what Fauci said was that this whole COVID-19 reaction has become political. And that's just unfortunate, and it shouldn't be political. However, what he said was we need to look at the economy and public health as a gateway or a pathway to reopening the economy. But right now, it's appearing as a barrier to reopening the economy. And on the surface, subliminal level, that sounds great. Anthony Fauci is here to save the day and tell us that public health measures are the means to reopening the economy, and everyone will be as healthy as they are prosperous. But the issue that we really need to understand with this is that the economy is people. It's everyone. It's you and me. We are in this dynamic fluctuation of either consuming or producing, of either consuming or investing. So the issue becomes that you don't catch it at first, but the whole idea that we can reopen an economy in the within the confinements of public health is conceding everything that America stood for. What's left of a free market economy in the United States will be lost. That's the biggest concern. I don't know who said this, but someone said there's nothing so permanent as a temporary government policy or intervention, something along the lines. And the point is that when you look at the Patriot Act, when you look at the TSA, when you look at anything that's for the safety of the people that the government implements, it's there forever. And this comes from the notion that governments are risk averse, which means they don't let a good crisis go to waste. And not that, public health, I'm no epidemiologist, but so I cannot speak, on diseases. But the government in this situation is more likely to be incentivized to overreact rather than underreact. And this goes for many different areas. And although Fauci doesn't want this COVID situation to be political, because the government is involved, it necessarily becomes political. And this isn't the whole. This is why this guy Fauci is just someone to really be skeptical of, is because he says we want public health to be a gateway or a pathway to reopening the economy. The whole issue is that the economy is not supposed to have these barriers of entry. That's the whole point of having a market economy, is you have limited to no barriers of entry, for providing a good or a service. When you legally impose barriers of entries, this is how monopolies and quasi-monopolies form. This is why it's so hard to compete with these big name brands, is because there's so many laws in every nook and cranny that you look, and it makes it almost nearly impossible for the smaller cash in pocket investors and entrepreneurs to compete with these large firms. And I'm against this, because this is the whole thing. If we concede the economy to public health measures, the public health measures aren't just, it's not about the physical distancing. It's not about the mask. It's not about washing your hands. It's about allowing the government to have the authority to determine what is allowed in a business and what's not allowed. How many people are allowed to be in this business, which means how many consumers are allowed to be there. And the whole problem is this affects prices, and the government doesn't understand that when you intervene in a business, a lot of this additional legality measures, these costs become imposed on consumers. So, and then you go into the other issue of the government subsidizing everyone, and but it's not everyone. It's some people get more money in their pocket, but then it's who are the receivers of this additional printed money in their pockets, and then it becomes this whole situation of that when you just print money, no new services are created, but the quantity of money increases, so the exchange ratio becomes distorted, because money is never neutral. It's dynamic. It represents price ratios, exchange ratios. So that's the issue with inflation. That's why we can't just give money out of helicopters. And I'm just trying to work through this idea in my mind, and I'm gonna write a blog in a little bit about this, and I started writing a little bit, which I'll read right now to maybe kickstart some of this, but this was just in a book I was reading, and then I'll read this last paragraph, and it starts with: the issues are not necessarily the mask and physical distancing. The issue is the ownership of the sovereignty of determining non-violent economic activity and market participation. To create a gateway of any kind, by definition, eliminates any entry of market participation. This becomes another barrier of entry, but not just in one specified industry. This will apply to all industries, which would eliminate any remaining part of the United States free market economy. To allow for this to occur would be to concede the last of American freedoms and officially establish America on the road to serfdom. What would possibly precede will either be the government confiscation and possession of business and property, which is socialism of the Russian variety, or the government implementation of price controls, socialism of the German variety. In essence, the determination of who is allowed to produce what at which prices. Now, I cannot say for certain, but the way governments obtain control is not instantaneously. It's over a long, by design process of taking 2 steps forward, and then the people resist, and they take 1 step back, and then they take 2 steps forward, and they take one step back. And this is the whole issue, is that, the left doesn't understand that just allowing the government to concede the ability to establish an economy under the guise of public health is the road towards a more socialized economy. And the right of the conservatives, they have little principle. So it's really still up to the free market and caps at this point. I mean, someone else said that the lifeblood of the state is war. And many of the wars that the government of the United States government has involved itself with have become to be failures, catastrophic failures. The war on drugs, the war on poverty, the war in the Middle East, the war in Vietnam, the war on COVID-19. And allowing the government to enact public health measures of protecting the economy, of protecting individuals, is not a great idea. I mean, we already have the opening to socialized healthcare, which is Obamacare. That's the window. And if we continue to go further with Obamacare, then we'll have socialized medicine. And the issue with socialized medicine is that when you go from a market economy that has goods produced for the consumers, don't get it twisted. You can listen to an economist like Richard Wolff, but he'll tell you that the issue with capitalism is the fact that there are a couple people at the top, and then it trickles down. And basically, it's an exploitation of labor. He studies Marxism. The people at the top exploit the laborers, and basically they get all this money for doing essentially nothing. But the problem that he doesn't understand is that producers can only obtain their profits if there is consumer demand for their goods. If consumers do not purchase their goods, then the entrepreneurs who made these investments and the investors won't have the profits to sustain their company, and they'll go out of business and they fail. That's why the statistic for restaurants is that 97% of restaurants fail. Maybe it's 99, I'm not sure. But just because you're an entrepreneur and an investor and a businessman and a capitalist and you open up a restaurant doesn't mean it's going to succeed. It relies on consumer demand. And with a market economy, shoot, I kind of lost my point there. Socialism, Richard Wolff, economist. Okay, yeah, socialized medicine. So, what a lot of people who don't understand economics don't understand with the profit and loss mechanism or the capitalist organization of providing goods and services. The businesses look at the consumers as assets. They take money from people, and in return they provide a service or a good. And if people make the exchange, the consumers make the exchange, this demonstrates in their action that they would actually prefer to have that good or the service provided to them rather than the amount of money that they have in their pocket or their savings. This is could be looked at as an investment for one's life, or it could be looked at such as spending. And what's important to note is that when the government or the state takes over the health industry, well, first of all, with massive subsidies, this allows for the industries to receive signals that there is an increased in demand for their goods because it's being subsidized. So let's just say people have free money. Now they can pay for the service that they otherwise wouldn't have been able to pay for without the help of the government. This means that the signals going back to these firms just appear as an increase in demand, but this is an artificial increase in demand, and so the firms increase their prices. This is why the cost of colleges and universities have gone astronomically high, because you have the government subsidizing in financial aid and student loans, and it sends a feedback signal to the colleges to say, hey, like, a lot of students want to come here and they're willing to pay, so we can keep increasing our prices. This is the same thing that happened to the medical industry of healthcare and medical insurance, is that the government subsidizes it in the form of Obamacare and Medicaid, and they it sends signals to the health care providers and insurance companies that, hey, there's more people that want it and they can pay, so we can increase our prices. This is why it's the prices for healthcare are astronomically high. And what this means, when the state completely takes over the healthcare industry, we say, hey, we're the government, we're going to give you free healthcare for all our citizens. And people say, yay, free healthcare. No, this is okay. Yuri Maltsov had a great lecture, and I think he has a couple, on socialized medicine, specifically in Soviet Russia. But he's from the Soviet Union, and he discusses this. And the main principle to understand is that when the government controls something such as healthcare or education, it looks at the consumers or its citizens rather than assets like profit-motivated companies and firms do, as liabilities. And so there's no incentive. They're not operating from profits and losses. So just because someone gives them more money doesn't necessarily mean that just because someone pays a doctor more money doesn't necessarily mean that that's what incentivizes the doctor to do a better job. Now that's what happens with the black market. But in the state-provided systems where the doctors aren't just taking money, they're already paid by the government. So people don't pay the doctors. The doctors look at all the people that come in as just they're not consumers. They're consumers in the sense that they consume the service provided to them, but they aren't paying consumers. So everything is just a task. It's just a liability. Each patient that comes in becomes just a liability. So in Soviet Russia, after the age of 65, if you came in for anything to the Soviet-run hospitals where they had socialized medicine, they would give you aspirin and tell you to go home. They'd say, okay, go home and say goodbye to your family. Because there's no incentive to keep them alive. The elderly people. And a lot of people don't know this. Yuri Maltsov points this out as well, but Nazi Germany was home to socialized medicine. And with socialized medicine, they hired doctors such as Joseph Mengele and others, and they murdered a lot of people. And socialism, as a target, murders 10% of the population wherever it comes to power, whichever country. And this is by design for social re-engineering of people. Lenin wrote a letter, and it was a response where some comrades wrote, Lenin, these people, they aren't conforming, they aren't listening. What do we do? Lenin said, murder them. murder them. This isn't verbatim, but this is like, you can find this out in the Soviet Story, which is a documentary on YouTube. And he said, murder them in such a way that people hundreds of miles will be trembling with fear. And the issue with socialism is that there's no incentives. I have a video, a recent one, and I talk about 3 problems with socialism. One of them is the incentive problem, because no one's incentivized by profits. There are no profits. There is no profits to obtain. Well, this is socialism of the Soviet variety. So they have to intimidate you, and they intimidate you with murders and tortures, and they kill roughly 10% of the population. And this really motivates people to get things done, because no one wants to be murdered. And going back to socialized medicine, if we go this route of just having public health, which is just the state, run the economy, and socialized medicine, it's going to turn out poorly. And I can't predict the future, and I can't predict the next, if they achieve this implementations of their plan to take over the economy. But I think it will come in the form of hyperinflation. We're already beginning to see that, and with the new printing of the money, and price controls. They won't. People don't understand why prices increase after you print a lot of money. This is because, like we stated earlier, money is not neutral. The quantity of money in a society or in an economy reflects the amount of goods and services. And when you don't, printing money doesn't create goods or services. It creates more money. So the exchange ratio, or the purchasing power, diminishes. What was the value of $1 used to be $100, and maybe soon it will be $1,000. That could be in reverse. That's just dealing with the purchasing power. But I don't think that gosh, it was so sly the way Fauci just slid in. Oh, the public health should be a gateway. It should be a gateway to reopening the economy. And because of all the fear mongering, people just can agree. You can just nod your head, okay, and just go with it blindly. But we have to understand that the economy isn't something for the government to dictate. Once they dictate what is acceptable to be produced, don't forget that they labeled people by essential workers and non-essential workers. And the Nazis labeled Jews as either essential or non-essential people based on their occupation. So don't get it twisted. This is not some superhero fantasy that either Biden or Trump or Fauci is going to save us with. This is just how the state operates. This is their incentives. Dave Smith mentioned this recently. The state is the mafia parading itself as a United Nation global public relief something. I forget what he said. This is a late one for me. It's 1:30 in the morning on October 1st, and I just wanted to see if this midnight podcast would spark some creativity flows. We'll be back on these issues, so we're not going anywhere. Geigenomics is here to stay. We're coming at you live, not live, but every week. We're going to be putting back on YouTube, that is, and then also on the other podcast platforms wherever you listen to this show. But we're going strong. We're Geigenomics. When I refer to Geigenomics as me and the team, it's a select few highly skilled individuals and myself. And we're going all in. We're going in for the long haul. This show's going to be around for 20 years. And it's going to be putting out an episode at least every week. And it's going to be powerful. In the ANCAP society, there's a lot of great people. And this podcast is here to help me learn, to help me study, to help me think. And as well, I would like to build a following. And in order to do that, I need to, well, obviously read a lot and a lot more, as well as write a lot more. But think a lot more and have great ideas, powerful perspectives. And be a leader, be a strong leader for all the people who really want to listen to this. And if you know me in person, this is well, then we probably know each other. But this is the road that this podcast is going to travel. And like this coaster says, ideas are bulletproof. Thank you.